Right. So good morning, everyone. Sadly, we have 5 additional Albany County residents that passed away from COVID-19. 2 women in their 90s, a man in his 90s, and a man in his 80s, and a woman in her 70s. This brings us up to 223 total people passing away in Albany County since this started. Through the month of December, we've had 63 people pass away from COVID-19, which is the highest. In May, we had 55. So please, my condolences and prayers go out to the 5 families and goes out to all the families for these difficult times that you're going through. We can get through it together, but it's hard enough in the world we're in, and it's hard enough to lose someone regardless of the situation. So again, my condolences and prayers go out to the family. Yesterday, a lot of questions were brought up about the Joseph's house in Latham. Talked to the sisters there yesterday at length, and it brings up a point that I brought up in the control room yesterday to General Murphy the other day ago, was about these settings. My sister, Sister Bernard, my aunt Ashley, who's a little sister of the poor, they have convents and they have apartments that they all live together. They're not categorized under a nursing home. They're not categorized as assisted living. It's a convent for nuns, and they got places like that for priests and other people. But it also highlighted a thing this gentleman, a friend of mine, brought up to me about some issues they were having with congregate settings like this for seniors, not just here in Albany County, throughout the state. There's an issue in Rensselaer County with some senior complexes that have people over the age of 65 living together within 20 apartments, and they might be Section 8, they might just be living there. But it's an issue we need to address, not just for a health standpoint, but for vaccines going forward. And it's something that when the state Senate was in on Monday and they did the rent control, great. These are things that we've learned over the course of the last 9.5 months that we need to address. And this is one of them. We need to address these settings that have that loophole in the law where they don't have to report to the county health departments, they don't really have to report to the state health departments, but they are in a congregate setting. And we have to make sure that we don't have these issues going forward. And again, everything changes and we have to continue to readjust. We've learned from this. We've learned from our mistakes, but we got to just make sure reporting gets done, and that that our Department of Health can do their job. The state needs to, again, work with us. We need to work with the state. But these settings we need to identify. As we identified our nursing homes and other settings throughout Albany County, these are places that should get the vaccine too, after the essential workers, the nursing homes and the hospitals and the EMS and all of them get their shots. This is a category we need to identify as something that Mayor Sheen and I have talked about. We've texted back and forth about. She brought it up, her concerns too, with the variety of different places in the city of Albany that have settings like this. And again, they don't fall into the typical spectrum of the health department or nursing homes oversight or health because of the way they are established. We have over 65,000 residents over the age of 65 that are living here in Albany County, living longer, staying at home, or settings like this that we need to make sure that we address as we go forward and we set the vaccines up, and as we start to roll it out in the community, that we identify these places, most importantly, to make sure they get the vaccine, but make sure that we're making sure the issues are addressed going forward. So again, it's something that I learned, so I will be calling on John McDonald and Pat Fahey to look at a law to establish some type of oversights when you have settings like this in the state of New York, and do some type of bill to make sure in the future this doesn't happen again with anybody. So we're there to protect everyone going forward. So as of today, there's 11,448 cases of COVID-19 to date. There's an increase today of 256 positive cases since yesterday. Yesterday we saw an increase of 213. The day before that was 240. There are currently 2,956 people under mandatory quarantine. Of the new positive cases, 35 had close contact to a positive person. 1 reported traveling, 15 are healthcare workers. 205 don't have a clear source of infection at this time. Over the last 5 days, there's been an average of 220.2 new cases a day. Before that was 218. As of today, 37,383 people have now completed quarantine. Of those, 9,801 were infected with the virus and have recovered. That's an increase of 144 since yesterday. Unfortunately, there's 11 new hospitalizations overnight. Our number does drop down from 127 yesterday to 120 people currently hospitalized from the virus. Yesterday it was at 129. And that number has been trending up since, like I said before, December 24th. There are now 20 patients currently in the ICU. Yesterday it was 21. Throughout the month of December, there were 396 new hospitalizations. That's 42% of all hospitalizations through this whole pandemic. As we continue to monitor the Capital Regional's hospital capacity, and the hospital beds available remain steady, now around 26%. The ICU beds are roughly around 19%, the same, that stays the same. I can assure you there's a plan of actions with the regional hospitals, with the state, and with my office that we're looking to address these issues. So if we do run into that problem, you don't see what happened in California, where they had to make midship hospital rooms in parking garages or outside in tents. So we are looking to address this issue as we go forward, and I thank the governor for his leadership on that. I continue to urge people, please wear your mask, cough into your arm, clean your hands, stay 6 feet apart, and we'll get through this. I know you keep hearing the same from Dr. Whalen and I and everyone else, but it is working. It's just one, like I said, it's just one tool in the arsenal that is helping us get through this. And there's a variety of other factors. And again, please continue to do the right thing, and we'll get through it. We're asking everyone today. I know it's New Year's Eve. It's a big night. Stay home, celebrate. Let's end 2020. Let's leave it in a rear view mirror. Let's just leave it behind us, and let's move on for 2021 with the vaccine here. Let's look at the positive side of the house, right? Let's look at the good things that are going to come in the next few months. But your actions, just like on Christmas and tonight, will affect us through the month of January. So please, make it where I'm wrong. I've said this, and I've had my critics say, oh, he's wrong, it's not going to be a terrible month. It was for December. Dr. Whalen and I have said this. And I said the same thing about January. I hope I'm wrong. I hope you call me out and tell me that, hey, Mr. Executive, you said, and I can say, hey, look, the data we're looking at were wrong, but you know what, it turned around. And that's what I'm hoping for. So my New Year's resolution is going to be that people do the right thing, stay home, socially distance, and we can start to hit that curve where we're going downwards, and take care of people as we go forward. It's been tough. And one of the things I want to say, throughout this pandemic, we have seen the coronavirus wreak havoc across the globe with the loss of nearly 2 million lives. No place has been spared, including here in Albany County, where COVID-19 has taken hundreds of county residents in a span of 9 months. Now, as we battle back against this horrifying disease with a safe and effective vaccine, it is critical that we band together as one community. For together as one, we can beat the virus. Together as one, we can protect our community. Together as one, we can save the lives of our loved ones. So please join us. Let's stand united in our effort by all of us taking the vaccine when it's available. There's nothing we can't do, and there is no battle that we cannot win united in Albany County. I want to remind people, more and more are saying that they're comfortable with taking the vaccine. The polls show 63% of Americans are willing to get the vaccine compared to 58%, compared to 45% a few months ago. But we still need to educate ourselves. We still need to make people feel comfortable taking the vaccine. Dr. Whalen.
And the last time I was here, I think, was Christmas Eve, and we were talking about the importance of staying home. And of course, this is as important now as it's ever been. It's been certainly a busy, very, very busy 9 months for us at the health department, and we know now we are entering into our busiest time because we are at the peak of cases that we are getting. We are very busy with case investigation, and now we are preparing to join our partners at the regional hub and start to vaccinate. It is likely that our health department will be getting a shipment in as early as next week. And we continue daily work with our regional hub. I, this morning, visited one of the pods that has been stood up by Albany Medical Center. And, you know, it was a great effort that they have stood up. They are getting people through quickly. I was finishing up a call with them when I came in here today. And with the 8-county region so far, it looks like over about 18,000 people have been vaccinated thus far. And these numbers are growing every single day across an 8-county region. So the hospitals are currently participating in vaccination for the 1A population, and the local health departments that are in the hub look forward to joining them next week. For us, it'll be a little bit different because we do have the majority of our staff doing very time-intensive case investigations. So we will likely be doing not daily clinics, but we'll be doing larger numbers over shorter periods of time, consistent with the planning that we have been participating in for years to do this. So we look forward to providing more information. We're of course monitoring the guidance that is coming out of the governor's office and the state health department on prioritization. We will be strictly adhering to that as we start to roll out. We know that our vaccinators through our health department staff and our medical reserve corps are going to be eligible for vaccine. And our forward-facing staff will be eligible. So all those that are going to be working in the pods when we get into our large-scale rollouts will be vaccinated quickly, and then we will also be assisting with other members that are currently prioritized to be vaccinated. So we're excited about this. This is what we have been waiting for. This is what we have been training for, and this does signal the beginning of the end. But it is not a time to let our guard down. We still predict that January will be a worse month than December. The numbers overall of the population, although they're growing every single day that are vaccinated, certainly are not enough to be protective, and even those that have been vaccinated should continue to wear masks, social distance, and wash their hands. We need to be mindful of our high-risk populations. And, you know, as Mr. McCoy was just discussing, you know, we want to make sure that we have the strategies in place that we need to vaccinate our at-risk populations. This is something that has never been undertaken before in public health. It is a coordinated approach. I am very pleased to say that you know, our partners at Albany Medical Center and Dr. McKenna have been fantastic partners with all the local health departments and the hospitals in the 8-county region. We have daily meetings, and everything so far has been transparent, and everyone is sharing information as we get it. And I think that this certainly lends to the strength that we need to be able to face the task at hand. So this will be something that obviously will continue for the coming days, weeks, and months as we roll out vaccine, as the supply comes in to our region. And we'll be providing information on that as we get it. But for now, the guidance has not changed. Everyone really needs to continue to be very mindful about their behaviors, and particularly on a night like tonight. You know, when we're so close, it's important for people not to lose sight that COVID is still not finished with us. It is still causing a great deal of sickness, illness, and we are seeing hospitalizations and unfortunately deaths every single day. And this does occur across the span of ages. So there's no guarantee, because you're young and healthy, that COVID cannot seriously affect you. So please continue to stay home, continue to Protect yourselves and your families, and I wish everybody a happy new year and a better year for 2021.
And again, please, if people haven't seen the reports, there's probably going to be some snow and ice tonight. Be careful out there, and be careful walking or driving. And again, to help us get through this and to identify it, get tested, whether you have signs or symptoms. Great partnership with Whitney Young. You can always call. If you don't have insurance, we pay for it. 518-465-4771. And also, Albany is at 188-364-3065. You need to schedule an appointment with both places, Whitney Young and Albany. You can't just walk up. And again, you can go to our website, albanycounty.com, and you can see the times and places and the wait times and all that stuff and the age requirement if you have children you want to get taken care of. So again, I want to remind everyone, Rite Aid is doing kids now from the age of 13 on up. They weren't before. They're doing it now. Also, I believe that's free when you go through Rite Aid. I'm not 100% sure, but I think it is. So, and if you need mental health support, as always, 7 days a week, 8 a.m. to 5 p.m., 518-269-6634, and our 24-hour sexual assault hotline number, 447-7716, and the 211 in the New York State hotline. And as always, please stay safe out there. I hope everyone has a great New Year's Eve, stays home by themselves or with your immediate family that you've been around, and we'll get through 2020 into a better 2021. And please stay safe out there. Thank you, everyone. Happy New Year's.